basically covered employees, covered employers rather, have to provide employees who are eligible with up to 12 weeks of unpaid leave during any 12-month period for any of the following reasons. And that can be the birth or care of a newborn child. It can be the placement of a child for adoption or for foster care with that employee. It can be for care for an immediate family member, like a spouse, a child, or a parent who has a serious health condition. Or you can take medical leave when the employee is unable to work because of his or her own serious health condition. Okay. Let's talk first about leave to care for a family member. So the employer has to provide the FMLA leave to care for a family member. Often, of course, that'll be a sick parent, could be a child, something like that. An employee has no legal or biological relationship to a child, can be entitled to FMLA leave to care for a newborn placed child with a serious health condition, or providing either day-to-day care or financial support if the employee intends to assume the responsibilities of a parent. So, for example, if a child were with you informally or with an employee informally with the intent for the parent to adopt or become a guardian of the child, then that child would, care for that child might well fall under the FMLA. Now, one question, of course, is what is a serious health condition? And sometimes what employees think is a serious health condition isn't what the statute or the employer thinks is a serious health condition. It requires the employer to provide FMLA leave to care for an immediate family member. Eligible employees are entitled to FMLA due to their own or an immediate family member's serious health condition. Now, the serious health condition actually means an illness or an injury or an impairment or a physical or mental condition that involves either inpatient care, including like an overnight stay in a hospital or hospice or residential medical care facility, and that includes any period of incapacity, like the inability to work or attend school or perform your regular activities, or subsequent treatment in connection with that inpatient care. It would also include continuing treatment by a health care provider, which includes a period of incapacity, which is more than 3 consecutive calendar days, and any subsequent treatment or period of incapacity which relates to the same condition. And now that also includes treatment 2 or more times by or under the supervision of a healthcare provider, in-person visits within the first 7 days of the serious condition, and those occurring within 30 days of the first day of incapacity, any period of incapacity related to pregnancy, prenatal care, a period of incapacity or treatment for a chronic serious health condition, which continues over an extended period of time and requires periodic visits of at least twice a year to a healthcare provider. And you don't have to see the healthcare provider for each absence. A period of incapacity that's permanent or long-term because of a condition for which treatment may or may not be effective, and only supervision by a healthcare provider is required rather than active treatment, and absences to receive multiple treatments for restorative surgery or for a condition that would likely result in a period of incapacity of more than 3 days if not treated. One example of this that springs to mind, just because I have a sister who's undergoing it, is chemotherapy for cancer treatment, of course, and so that's one of the big ones, of course, that people experience, and then there are certainly others. So again, a serious health condition is certainly more than the common flu or something of that nature, at least for most of us.